Naltrexone is really important for opioid addiction for the main reason that it works. Because without naltrexone, people just don't do very well. Patients really need some form of medication-assisted treatment. And the options, of course, are buprenorphine or methadone. But for 20 years, we've been specializing in naltrexone because it's a long-acting version of the drug, and it's completely non-addictive, so there's no withdrawal when you finish it, and it doesn't have any kind of getting people high or anything like that. But without medication-assisted treatment, people really don't do well. You know, if you think of people who go into jail and maybe they've been in jail for 3 months or 6 months or sometimes even 5 years, and almost all of them relapse as soon as they get out of jail and they have access to the drug again. It's just such a powerful addiction. We're not really quite why it's worse than other addictions like alcohol or even other drugs like cocaine, but opioid addiction has a very high relapse rate. In fact, I saw a study recently where they were using a form of medication-assisted treatment, and they had some people on the active drug and the other ones on the placebo. And the placebo success was only 2%. So people who were not getting the active drug had a 98% failure rate. And they actually defined success as people who had less than 20% negative urine. So the people who were not successful weren't even staying completely clean. So the bottom line is naltrexone is a very powerful drug. It's non-addictive and it's very useful. When we use it as the implant or as Vivitrol, it lasts either 1 month or 2 months, so it's very powerful and it lasts a long time, and it really helps people get into recovery and then have a chance to stay clean long term by taking away their cravings and allowing them to participate in their therapy and in their recovery program.